We have 2 items on the agenda that we have postponed.
9.
We're going to jump forward to agenda item number 9 because of the number of people here to make comment on that, and then we'll jump back to 8 after that. So number 9 is discussion and possible action regarding potential legislation related to Business and Professions Code Section 4827 and animal shelter services. And I'm going to go ahead and turn it over to Ms. Sieferman now.
Okay, so to make sure we're all on the same page, and I have to do a caveat. I haven't been here for the last 6 years, so if I say anything incorrectly, please feel free to correct me. But in April 2019, the board approved some MDC proposed amendments to specific to shelter settings. And these amendments had been going through the process for the last 5 years, and potentially task force prior to that. But they had held over 15 public meetings for opportunities for input. And the whole purpose of these shelter amendments was to make it easier for shelters who are currently required to comply with existing shelter standards, fixed facility standards. These amendments would make it easier for shelters to comply with those standards. The board recognized that there are some sections in there that may not be applicable that they wanted to address. And so that's what these regulations were attempting to do. Shortly after, though, the board adopted this language, we started being inundated with concerns from shelters and organizations and requested that we put a halt on the regulations and allow more time for public participation. I clarified all the opportunities that the board has provided thus far. My main concern being that the rulemaking process is not a speedy process. It could take up to 2 years to do. And so I said that we would proceed with the rulemaking process. However, I also identified the opportunities for public comment that are still coming. This would not, I don't recommend stopping a process that still has 2 years to go with so many opportunities to still hear concerns. But with that, there was also clarification that I provided that if shelters are providing veterinary services as defined in statute, they would be subject to the requirements and have to get a hospital registration. So with that, there were some requests to potentially exempt shelters if they're providing specific services, exempt them from the requirement requirement for a registration. Thereby the board would not be able to go out and inspect and to have the same kind of standards for shelters providing limited services. I did provide the board with some of the letters that we've been receiving and also our responses. Since then, some of the concerns, the organizations and the shelters went to Assembly BNP, went to Senate BNP, and then went to the governor's office to request assistance with some potential legislation. After that, the governor's office contacted DCA Executive Office and asked for their assistance. That is why we have the Deputy Director of Legislation here. Dennis is here to provide input on his role and how he became involved with that. And then members, I'd like to, after we hear from Dennis, to turn it over to the public so you guys can hear firsthand from them what the concerns are and what the request is.
Good afternoon, board members. My name is Dennis Cuevas Romero, Deputy Director of Legislative Affairs for the department. Here in my capacity to simply provide factual information of where we are in the process. As about 2 weeks ago, the governor's office, or the signed deputy that handles DCA, reached out to us because a legislative advocate reached out asking for opportunity to have a conversation for a potential legislative fix to address this issue. Our office was brought into the conversation. Since then, we essentially have been asked to try to see if we can reach a compromise or resolution. At this point, we have had conversations with the governor's office on this issue. The Senate Business Professions and Economic Development has also been engaged. They are open to continuing conversations if a legislative fix is necessary. At this point, that's where we stand. Our office, DCA, has made it clear to the governor's office that this change in regulations is not imminent. It still will require probably at least a year at the very earliest to have any regulations promulgated, and there will be sufficient time for public input and stakeholder process. So I think there was initial confusion in terms of the timeline, and we just wanted to make sure that we clarified where it was in the process. I think Jessica did a very good job of trying to do that, but when there are multiple layers of conversations and different people in conversations, I think there's just a miscommunication, and we simply wanted to get involved to make sure that all parties were informed on where we are. So the department is here to try to assist and potentially convene a stakeholder meeting if necessary, but that's where we are, and I'm here and available to answer any questions.
So we would like to invite other members of the public, and we certainly will hope that Dennis will stay close by as well if we need him.
Hello. My name is Jill Tucker. I'm the CEO of the California Animal Welfare Association. Really appreciate the opportunity to talk with all of you about this. And I want to first say that I recognize that a lot of work has gone into this over the years, and there's been a lot of discussion and a lot of back and forth. What I see has happened is that we've been looking at this as kind of a single issue when it's actually two. The proposed regulations that have come up are a good move toward what is an appropriate structure for overseeing shelter medicine in our state shelters. However, through all of this discussion and the communications, we have not yet addressed the kind of gaping hole off to the side of the shelters that don't have veterinarians and don't have the kind of access to veterinarians that would allow them to have a veterinary premise permit on site. And so I think we need to separate the issues and have separate conversations about that. What our concern is, we've got a lot of concern from member shelters around the state about their ability to comply with these regulations. And to help quantify things, we did kick out a survey to all of our members. And out of 101 sheltering facilities that responded, 26 are operating without premise permits right now. And the comments in the survey indicate that those shelters feel that they're not in a position to get veterinary premise permits. Now, I want to be clear that these shelters that don't have veterinarians on site are still getting veterinary care. They're just outsourcing it. So animals come into their facilities, and if they're sick or injured, they take it to a veterinarian, and those animals are treated at a vet hospital, and that's good. Our concern is that to protect the health of the animals within their building, so these shelters have a legal responsibility to take in all these stray animals and put them in a building together and hold them and wait for their owners to come or give them the ability to transfer them out or adopt them out. To protect those animals while they're in their care, we want shelters to be able to provide basic preventative care, including over-the-counter vaccinations and parasite control. We're not asking for shelters to be able to diagnose and treat things without a veterinarian. We want shelters to use veterinarians. We want more veterinarians in shelters, and this is an issue we're tackling with Cal Animals. It's a priority. In fact, we've got another CEO gathering this fall where this is going to be a big topic of discussion. We're trying to figure out how to recruit more veterinarians and get them excited about working in shelters because we're having a really hard time filling positions. And so what we're really, our concern is that if this goes through, or if enforcement takes place where shelters are told you can't vaccinate animals because that's considered the practice of veterinary medicine, if their alternative is to not vaccinate animals, that's not good. And as all of you care deeply about animals to even be doing this. So we know that if animals coming into shelters aren't vaccinated, they're at huge risk for illness. And so that would lead to more euthanasia of shelter animals, and it will also reduce the possibility that the destination shelters that have more resources are going to be able to pull from those source shelters, because nobody wants a truckload of distemper. So we feel like it's really important and reasonable if shelters were allowed to provide these basic over-the-counter types of vaccinations and flea and parasite control that the average Joe can pick up at the feed store. And to do that, to just provide some basic protections for the animals in their care, and then if they're sick and injured, they can take them out to a veterinarian for help. So we've come up with some proposed adjustments to 4827 along these lines that we feel are reasonable. Again, we don't want non-veterinarians diagnosing and treating things. That's not the intention here. It's really what should shelters reasonably be able to do as guardians for these animals in their care. So you can see the first one was to administer preventative vaccinations to any stray, injured, homeless, or unwanted pets.
Sorry, Jill, to interrupt, I'm just going to provide clarification. The amendments that are posted on their website right now are not the most recent amendments that she proposed. The ones that are projected, though, are, and you guys received them in their packet, and we'll work to get those updated so everybody in the public can see them as well.
Great, great. And I do want to mention, I mean, the feedback from our members is it's really weird that the statute allows shelters to euthanize animals without a veterinarian, but not protect them with a vaccine. So we're hoping that a fix like this could address those issues. So provided, we've got people trained in the appropriate use of the vaccines, we want them to be able to vaccinate. And if you want to keep scrolling through, it's 4 basic things. Medications for control of internal and external parasites. When they take an animal to a vet and the vet orders some, or well, they spay it and they send it back with pain meds, or or are treating something, and just as you would with an owner, you want the client to follow up and provide the medication. Shelters need to be able to administer that medication that's prescribed by veterinarians within their kind of home shelter environment while the animals are there. And then it's really basic first aid. So, if an animal's been injured, we want to be able to stop the bleeding while they're taking it to the veterinarian. So none of this is to preclude veterinary care, but it's what we feel is a really simple compromise to what has taken place and the concerns that we have among shelters throughout the state.
Jill, just to clarify the ask of the board, because before it was asked of us to stop the rulemaking process for the regulations that they approved, is it still to stop that and support this legislation, or is it to allow the regulations to go through the rulemaking process and then support this legislation?
I'm not clear on the timing. I've heard 1 year and I've heard 2 years, and so with legislation, we would want this to go through before the other regulations take place. I will say, so as a separate issue, those proposed regulations, I've still gotten feedback about concerns. I am concerned that there are some shelters that currently have premise permits that are not going to be able to keep them when they were looking at the requirements of these. Some might have them and they might be doing very basic things, but they don't have emergency equipment and oxygen, or they don't have the type of relationship with the veterinarian where they're providing direct care as specified in the proposed regulations that they've been asked to, can that be indirect? What if my vet is on the phone, or So those are still kind of issues that we would love the opportunity to look at if you're still open to some amendments on that. So we're not saying don't, run with that, but we are looking for support for this type of change that we feel is reasonable and appropriate for shelters.
So, the good thing is that we all want the same thing, which is the best care for the shelter animals. And there never was any intention for our proposed regulations to say that shelters can't give vaccinations without a veterinarian being there. So my question is, you did mention on the survey that you took that there was like 26 shelters that don't have a premise permit, but they still have a veterinarian that they can use for their sick pets. Would it be much of a stress for those shelters to ask that veterinarian to make protocols? Because we are totally in support of these 26 shelters to be continuing to give vaccinations, of course, because that prevents disease outbreaks. But a veterinarian should at least write protocols. The veterinarian doesn't have to be there when you're giving the vaccinations, but at some point, I would like to see a veterinarian write the protocols that the shelter follows. Is that reasonable?
That sounds reasonable to me. I think, the challenge some of these organizations face is that they're in rural areas and the nearest vet's an hour away. But that doesn't mean they can't find a vet, or they could possibly find a veterinarian running another shelter that would share protocols. Is that the type of solution that would be okay?
They may be an hour away, but you've told me that they will still go that hour
They will.
if the pet needs it, because all of us love animals and will do many things for them.
Right.
I fully understand your concerns, but I was hoping that we could at least get some veterinary oversights to establish the protocols that you use in the first place. The veterinarian doesn't have to be there for you to give the vaccinations, but at some point, we would like to see veterinarian oversight.
Sure.
Hi.
Hi.
I think we just need more details here to start with. For instance, of these 26 shelters that you mentioned, so they have no veterinarian that practices on site.
Correct.
Okay. But there are other shelters, many shelters that have a veterinarian on site, either full-time or part-time. Okay. And all those have, as far as you know, all those do have a premise permit?
Yes.
Okay. So we're just talking about ones that don't have a veterinarian on site.
Right.
Okay. Go.
I would say for this discussion, the good news is we're still in the middle of this process and we can make changes. The unfortunate feeling for me, and I'm not on the MDC, but I've been to many, many of the meetings, is I'm confused at how we got to this point where there was a lot of your concerns were not there when I was in many hour meetings at MDC where the minimum standards have been discussed over these last few years that I've been on the board. And I just feel like we had input from a lot of different folks to create these from your community. I'm still confused as to how you all were not part of that, or maybe, that's just what I worry about is did we miss other things? It didn't seem like, it seemed like we had stakeholder hearings, long-term and there were members on the MDC from shelters for either RVTs or veterinarians and things like that. So it was long discussed, and I'm concerned that you all were not aware of it or part of it.
Our former executive director was involved, and I'm not sure why it got muddied, and it seems like we just kind of passed each other because, and I've got a letter went out Friday with letters that have been coming through. We had, some from this year, from 2018 and 2017, and every one of them says some of these shelters don't have vets, and to some degree of that. And I'm just,
That was all part of the discussions during these meetings, too,
It was.
which resulted in these guidelines, so that's why I'm,
Yeah, so I'm not sure why a solution didn't come up for what do we do with the shelters without the vets? Unless there was one we haven't heard, but we didn't see one come through.
Dr. Sullivan?
You ready? Hi.
Dick Sullivan, MDC member, but also worked on the premises permit for more years than I want to admit. But I think if, instead of focusing on the shelter medicine regs, which is 2030.6, I think if we look at 2035.5, which is the duties of the supervising veterinarian, I think all four of those issues can be addressed there. In that, a supervising veterinarian does not have to be on the premises. A supervising veterinarian can be the veterinarian that's in the community or even 100 miles away that is responsible for setting up the protocol, responsible for training the staff, whether it's an RVT or a veterinary assistant, to do basic functions. So we have in section 2A that an indirect supervision of an RVT, veterinary assistant, controlled substance permit holder, or a veterinary assistant may vaccinate or give prophylactic control of internal parasites and external parasites on intake. I think that's your item number one. Indirect supervision of an RVT for the treatment of clinical conditions based on the animal's symptoms. And the other things. Now, I think on the second item, there was the issue of, I believe you said, following up with medication once a veterinarian did a spay and neuter or treated an animal. That's, like you said, no different than a client following up with medication under the orders of the veterinarian. That you can do today. Once that veterinarian does the treatment and gives the order to an employee of the shelter, it's no different than giving the same directions to a client.
Without a premise permit.
Without a premise permit, correct. They're following the directions of the veterinarian. So that can be done today, whether you have a premise permit or not. The vaccines would have to fall under protocol, which would require a premises permit. But the veterinarian doesn't have to be even on staff. It can be a consultant in the area. Kind of when we were looking at this, we're looking at it more from the way large animal medicine is practiced, not the way small animal practice. Large animal practice, the veterinarian goes out to a herd, trains the staff, trains the employees of the dairy, what to look for and what to follow up on immediate treatment. And if there's a problem, they call the veterinarian. If it's out of their scope of that protocol, then they get the veterinarian involved. That's the concept that we're looking at rather than treating individual animals like we do in a small animal practice. So of the four items that you're asking to have a statutory exemption, I think we've already addressed under 2035.5. And I would be hesitant to try to address this with a statutory exemption.
So our concern is that these shelters are saying veterinarians are not willing to maintain the responsibility for a premise permit, and that there are a number of shelters that can't meet the facility requirements either to have a premise permit. So I'm just wondering if there's a way to separate having a veterinarian that can write protocols with having to pay or, get that veterinarian to accept responsibility for this location. And sometimes you're also talking about, government agencies. If a veterinarian's an hour away, I'm not sure it's feasible, or I don't think it's feasible for them to be training the individual staff. Like, there could be a protocol, but the shelters themselves are going to have to maintain responsibility for that.
I would politely disagree with that. If it's a premise permit, there has to be a licensee there. there has to be license oversight or we don't have any oversight. We have to have a license in order to be able to inspect. We have to have a licensing in order to have authority. Again, I'm not in your business, but conceptually, Davis has a shelter track medicine. I would think that that's a great resource to look for new graduates coming out to undertake the job of maybe 3 or 4 shelters. And again, working with them on the idea of a large animal practice. If there is a problem in the shelter that's medical, yes, they have to go there and handle it. But setting up the protocol and teaching the level of training of how to give a vaccine is not something that's going to take days, that's for sure. I mean, the concept is pretty simple and straightforward and needed. We are definitely in favor of getting those animals on intake, getting them vaccinated, getting parasitic control. That's why we wrote it this way. So when I looked at those 4 items, 2 of them you can already do, and the other two I think are covered under 2035.5. Is it going to be some work? Yeah, but I think your organization has to develop minimum standards for what can be a shelter. I think there is some responsibility there.
So, I mean, we are working toward that. I mean, we do want more veterinarians in shelters, but at this stage, with the reality of not enough veterinarians to serve these shelters, the premise permit aspect of it is the deal breaker with this being a workable solution for our shelters.
Well, let's work on that then, because I think that if we're going to raise the minimum standard of a few shelters, this is the only mechanism that we have to do it. If they're practicing veterinary medicine, giving vaccines is pretty basic. And all we're asking is that a veterinarian in the community or 100 miles away writes a protocol and trains the staff on how to give a vaccine or how to give worming medication. I think it's doable, and board members, including myself, would be very happy to work with you on making it workable. And I'm sure that the shelter track at Davis would be very helpful in this area too. We have to address it.
Right. I understand what you're saying, but if we can separate the premise permit out of the equation, and if it's about protocols for vaccines, that seems feasible, but it's a whole other level of responsibility and liability for that veterinarian to put their license on a line for a facility that's not within their control. And that's the kind of pushback we get from veterinarians who really don't want anything to do with that. And then a lot of them, there's corporate chains that don't want anything to do with shelter premise permits. They're like, bring me your sick animals, we'll take care of them, but...
Well, I worked in a private practice a number of years ago in Madison, Wisconsin, and once a month we would go to the shelter and help them with their intake and literally set up protocol, and I think we just need to look harder.
Well, and I would say we also have rewritten the requirements for premise permits for mobile small animal veterinarians and for different aspects. So we will also have permits available for mobile practitioners so that they can accept the responsibility, but they don't have to have the fixed facility permit. So practitioners in the community or within a 100-mile radius can use their mobile small animal permit to train your staff and at these different facilities without having a fixed permit. If you choose to go that direction, I think that's another option which we've tried to clarify. Kind of the ironic thing to me is we really thought we were trying to make it easier for shelters to abide by the laws that are already in place that regulate you. So it's kind of ironic that we feel like we maybe have misfired, so, but I don't know if you're aware of the new wording that we have used to try to establish mobile vaccine clinic permits and mobile small animal permits. But those might be another area that would be very useful in rural areas. And then I'll shut up and let somebody else talk. Mark, did you ever hand him?
Yes, again, I want us to remain friends because we do have the same goal. The liability argument, all we're asking for is for the veterinarian to write a protocol. We're not requiring them to be there at the shelter to make sure that that protocol is followed. So if the protocol is not followed, in the board's eye, the veterinarian wrote the proper protocol. And so I don't think that there would be any liability issues for the veterinarian because what we're only asking is for them to write the protocol. If the shelter is not following that protocol, then, that's not the fault of the veterinarian. So I don't know if that argument that a veterinarian won't do it because of liability issues is as bad as you think it might be.
That's the feedback we're getting from our members that have been trying to get more
From the
veterinarians.
shelters or from the actual veterinarians?
From shelters.
Yeah.
And the other concern is in requiring that and requiring the facilities to meet the certain standards and to pay the veterinarians to do this work. Legislatively, that's looking like an unfunded mandate, which is a concern as well.
Well, again, the fixed permit wouldn't be required if you were using a mobile small animal veterinarian or a mobile vaccine clinic because they hold the permit. And so the facility would then be able to do the vaccines and the simple care, medical care. If they're doing surgery or something else, then that's a whole different ballgame. But they would be able to operate under the mobile practice permit and not have to permit their fixed facility if all they were doing is what we had mentioned in the 4 bullet points.
So,
Go ahead, no.
I was just thinking that I think the mobile option is very interesting and something that some of our shelters will look into to see if that could be a way for them to offer more treatments. But I would ask the board, why can't a shelter offer basic over-the-counter vaccines that people get at the feed store?
You want me to answer that, or do I can?
I just had a separate question, which is relevant to the overall goal. You mentioned that shelters can euthanize, and that's under the penal code. So the penal code, specifically Section 597F, provides for abandoned or neglected animals and duties of public authorities in euthanasia. So this is kind of, the shelters and why they have to take possession of abandoned or neglected animals. Have you considered getting the legislature to take a look at that? There are provisions that require the animal control officers to deposit the animal with a veterinarian if there is a wound or a medical problem. Seems potentially more appropriate for the shelters who are required to take possession of the animals to seek exemptions or authority to vaccinate, provide wound care, administer prescriptions that a totally different veterinarian had issued to the animal that is now being dropped off at a shelter. Have you considered going through that approach where the legislature actually considers what shelters should be doing when they take possession of these animals versus the Veterinary Medical Board trying to figure out a carve-out for shelter situations where our concern is why should an abandoned or neglected animal receive any less care because a veterinarian can't be found to supervise the individuals who are taking care of the abandoned animals. We're concerned about that, and I know that the shelter arguments included that which was these animals need the same level of care. And if we can't provide that because there's no supervising veterinarian who is willing to take on the responsibility of drafting protocols for administering vaccinations and providing wound care, perhaps the legislature should really consider what animal shelters should be doing under the penal code, which requires them to take possession of the animals.
So to answer your question, we haven't looked at cracking open 597 to adjust it there. We went straight to this one because it relates to the practice of veterinary medicine and already has that language in there about shelters being authorized to do euthanasia without a veterinarian. So, and I want to reiterate that sick and injured animals do get veterinary care. We're talking about just not doing that in our building. Hi.
Grant Miller, CVMA. I'd like to point out that the existing exemption in 4827 regarding sodium pentobarbital says that a shelter employee with proper training can euthanize an animal without the presence of a veterinarian, but it is implied that obviously a veterinarian is involved because that's how they get the sodium pentobarbital in the first place. So I would encourage you not to mistake the two sets of exemptions. There is a veterinarian involved with that. They're not there. They're not present. But obviously they're involved because that's how you get sodium pentabarb. The other thing I'd like to point out, and Tara had touched on this, is giving the vaccination is not the issue. Formulating the vaccination protocol is what we're talking about. And who should be doing that? Who should be formulating a deworming protocol or a first aid protocol? That should all be, in our opinion, a licensed veterinarian, because our law says that you cannot institute treatment, therapy, relief, cure of whatever nature unless you're a licensed veterinarian in the state of California. These talks over the last 5 years started with this concept of, can we do this without a veterinarian? And when the MDC tasked our organization with creating a task force which involved members of then CACTA and SHAC, which were the two organizations which was now merged to make CAWA, which is this organization, those members concluded with us that having a premises permit was in the best interest of the animals. Now, there were other points that we disagreed on, but we brought that forward to the board and thought we had consensus. And then at the meeting at Fresno at the zoo, the MDC reassigned the task force again to go back and look at it all again. And this time the task force, instead of being headed by the CVMA, it was headed by SHAC and CACTA at that time. It was all the same people. But we looked at it all again, and we came out again and said, okay, you don't want it to just be RVTs. We'll go ahead and talk about it being veterinary assistants. You're worried about rabies vaccinations to animals that are relinquished to the shelter and medications being given to animals that are relinquished to the shelter and all these circumstances. Sure, we'll go through all that stuff and find ways to kind of bend for you on that. What it's come down to in the end, though, is do you need to have a veterinarian present when there's a premises permit and when the veterinary care of animals is being rendered? And that's the basic question. So I guess, from the standpoint of looking at this here, even looking at those exemptions that they're asking for now, which is really kind of a statutory thing, 2 of them imply that a veterinarian is present there, which suggests that there's some understanding that there's a need for a veterinarian to be present. So I think that we can work on solutions to finding veterinarians. I think you and I found an example earlier this week of, a situation where there could be some advertising done or something done to really try to better attract a veterinarian. And it might just be in the outreach and the wording and then some collaboration in finding them. But I do think it's possible. I think the veterinarians are out there. And I think that there are people who are interested in doing this kind of work. We just have to reach them and make it something accessible.
Where, We are hoping so, ultimately. That is our goal, to get veterinarians in. But I'm just going to reiterate that the reality we're facing right now is that we don't have them to fulfill this role. So we'd like to be able to just make sure that these shelters are able to provide these basic functions and continue to outsource their care if that's the solution that they've come up with that most appropriately fits their communities.
Excuse me. Good afternoon. My name is Jason Segan. I'm here with the Kings County Sheriff's Office. As many of you might know, Kings County is located in the heart of the Central Valley, right in the farming capital of the world. And our shelter is run by our sheriff. And we actually went out to RFP not too long ago for a part-time veterinarian, and did not get one response back. We're operating the best we can with our professional folks that have been working hard with the animals. We do everything we can. We just think if we can find a solution, otherwise we're going to have to really think about what we do and how we do it. And the sheriff's concerned. He doesn't want to euthanize more dogs or animals that come in. He wants to find a good solution for this. And we're hoping that putting our heads together and figuring this out to come to a good consensus is what we're hoping for. We're kind of in a unique position. There's not many areas like Kings County with where we're situated. We don't have a big draw of professionals, veterinarians in the area. We've got to take our animals that are injured a long way, and we do, and we do what's best for them. So we're just here, and when we heard about this, our sheriff did not know anything about everything that's going on, and really appreciate the outreach, and we're going to be following this now very much more closely, and trying to be at every stakeholder meeting, because we know having a voice at the table is very important. But we're just hoping for a good solution, and that places like Kings County get taken into consideration, because we don't have that big well to draw from. Thank you.
Shall I scoot?
You can come back if you need to, Joe.
Good afternoon. Lee Kamrick with the Rural County Representatives of California, and I just wanted to quickly echo the comments that were made by Cal Animals in the Sheriff's Office. In addition to the concerns and the challenges of finding these veterinarians, we just also wanted to raise some general...
I'm sorry, can you speak closer into the microphone?
Yes, sorry. We also just wanted to highlight the challenges that our facilities face in upgrading to the standards required by a premise permit. Thank you.
So remind me again, this was the language was already approved by the board at the last meeting. So right now it is where? And
So it's currently at its infancy stages right now through the process. Staff will be working with legal counsel to draft language. It needs to go to DCA for review. It still has a number of steps to get through before we even notice it for public comment.
so
By
if
draft
we do
language.
anything, we have to pull it back from where it's at. That's the first thing we would have to do if we did something. Or can we just change it without losing its place in line, I guess?
So you have two different things going on at the same time. You have your regulations, which you can change at this point if you wanted. But I think that the bigger ask from the shelter industry is the legislation, and so those happen two separate. So you can. I haven't heard any specific requests on the amendments for the regulations. More so the legislation.
Okay. I mean, the good thing is that a lot of proposed amendments from this organization are kind of already in our regulation. The ability to give dewormings and so forth. That's so. Most of the proposed regulations are not going to be difficult to accomplish in the language that we put forward, as God our Father has pointed out. But it seems the only sticking point is that requirement for there to be a veterinary premise, a premise permit.
Because there's activity.
Because there's activity. And, it's all about compromising, so I do think that it's not an unreasonable request.
Cheryl.
So Jessica, can you clarify, so if there's veterinary medicine, if there's a full-time or part-time veterinarian on the site, then of course then they need a premise permit. So these 26 locations that she's referring to, where there is no veterinarian, they take their animals to a veterinarian at another site and bring them back and treat them per the instructions of the veterinarian. Do they need a premise permit?
So I'm looking for the statute on when a registration is required, and it's when the veterinary services are being practiced, they have to have a premise registration. So if they're being practiced on the site, they would have to have a registration.
Yes.
I'm not the attorney, so
Yeah, so
Tara,
this
please
is a
correct
question
me
for
if I
Tara.
misstated
So if
that,
there's
but-
no veterinarian on site, there is no veterinarian on site. When they have veterinary needs, they take them to another location, they take them to a veterinary hospital, the animal's taken care of, they bring them back and just continue treatment. Do they need a premises permit?
Today, they need a premises permit anytime they are providing care or treatment to these animals, today. So what we did with the shelter regs was create an exemption specific to shelter facilities for minimum standards and specific tasks that non-veterinarians could perform on the animals under indirect supervision.
Okay, so under
So-
our proposed regulations, would those 26 hospitals need a premises permit?
It's hard to say.
Yes, they still would.
Still would,
Which
okay.
is this page, animal shelter facility. So those are the new minimum standards for those. And then if you keep scrolling, you get to 2035.5, I believe. And this is the real sticking point right here. Duties of supervising veterinarian. That's modeled after today's, we already have existing duties of a supervising veterinarian and how they supervise RVTs, VACSP holders, and veterinary assistants. This is specifically aimed at the shelter scenario that would authorize the RVT, VACSP holder, VA, to provide certain parasitic treatment, wound care, all of that is in the proposed legislation, but all of this requires supervising veterinarians and indirect supervision. So effectively, the proposed legislation is modeled after our regulations, and the only thing that we're waiting on for the regs is to start preparing the rulemaking package. That's where we are. So it sounds like if you wanted to address their concerns, you would need to pull this reg proposal back for additional review. Or you hold on to it.
I don't believe
And-
that's what they were asking. They were asking no premise permit, period.
Mm-hmm.
So even if you pulled this out, we still are requiring a premise permit.
Right, and to get the exemption from premises permit entirely, I would argue that would take legislation.
I forgot what I would, pass for a moment.
I'm just wondering, is there ever a situation where people, like Kings County, can't meet the requirements because they haven't found a veterinarian and they can't find a veterinarian, where they could ask for an exemption, just like on a case-by-case basis? I know that adds a lot of work to us, but, where they've provided documentation that they've looked for a veterinarian, they've, done these things, and all that they're providing is vaccinations, and then they submit the protocols they're using. I mean, I don't know really, do we really want them to be shutting down? So I understand their concerns. We don't really want them to be shutting down. We definitely want them to be following veterinary standards to some degree, but is there ever a time that like you can write for an exemption in a regulation or a legislative body? I just don't know if that's ever done.
Dick Sullivan. When I read the 4 conditions that they were requesting an exemption from, I didn't read the word premise permit in there. What I read was they're exempted from, they're exempted, they're allowed to be doing these things. I didn't see the word premises permit in there. It probably needs to be in there for those conditions. But I want to go back to Tara's comment. According to the logic of them having an animal treated and then taken back to the shelter where employees are then following the directions of the veterinarian, that particular shelter would need a premises permit to do that. Then under that logic, then every client that takes their animal home from my clinic and follows up with my directions on changing a bandage would also need a premises permit. So I guess I don't follow that logic. If a veterinarian treats an animal and gives specific instructions on what the client is to do to follow up, to me, that would not require a premises permit for the shelter.
Well, they're talking about situations where they have not taken the animal to a veterinarian at all. There was no treatment required. They're just intake and wanting to administer vaccinations and provide wound care, and a client or an owner wants to abandon their animal and they've got some pills that they got from a different veterinarian. They want the shelter to administer.
We did have that discussion. And that discussion was if the pills came with the animal.
It's in there.
Yeah.
Yeah, it's in there.
But I don't see how they would need a premises permit to continue treatment of an animal that they received that is under the care of a veterinarian. The example that they gave in following up on a wound treatment, as I read it, was once a veterinarian treated the animal and it came back to the shelter. That's how I read one of their 4 conditions.
So I think I'm looking at this as a whole. They don't want to have a veterinarian employed to provide vaccinations, wound care, all of that on intake. As far as clients and following veterinarian instructions, isn't that an exemption already for owned animals? You're not required to be licensed if you're practicing on your own animal. That's different because none of these animals are presumed owned. They are not owned by the shelter, so they don't have that exemption.
See, I knew you should have sat up front because you were going to.
No, you're right. Shelters do not own the animals. We're considered a depository. So.
Kathy. It seems to me that one of the other biggest concerns that you were articulating is the inability to, if we determine that the activities done at the location are veterinary practice, and then therefore needs to have a premises permit, so there's some regulatory board authority. But your issues are many of your locations can't get a premises permit, can't come up to some of the criteria that we require or want for premises permits for inspections and purposes and things like that. Is that part of it as well?
Yes, that is a big part of it. And in some cases, it's a facility with 2 employees. They got a guy in the building and a guy in the field, and the animals come in and they can't even do adoptions because they have no spay-neuter resources. So they need to be able to give vaccines, hold those animals, and then ship them out to shelters that can properly care for them and spay, neuter, and adopt them out.
But I would say that our board also would like that location to be of quality, that those animals are in good care at that location as well as any other shelter. Is part,
Absolutely.
the goal, obviously. And I thought that in shelter inspections, there are different requirements or different review requirements when inspectors look at shelters versus private practices, but I'm sure that's not what you're talking about. You're talking about the inability to even get a permit, qualify for one.
I would like to make a suggestion. I know that there is some reticence for us to do this, but I think it might be wise if we did delegate this back to the MDC for one more round. I know everyone's probably going to shudder when I say that, but I do think it's very important to consider the conversation and to keep going. We do feel as if we did due diligence, but obviously there's still questions. And so I would like to make a motion that we recuse this back to the MDC for one more round to just have this further discussion where everyone that wants to be present can be present one more time and have it discussed. I don't know exactly what that does to the rulemaking process, but it seems to me it doesn't stop it. I'm not looking at Tara because the MDC is an advisory.
Yeah, I mean, you're asking to pull the approved regulations back.
Yeah.
And send it to the
But
MDC.
if we have an open 45-day period where the public has chance to make comments, then we always reconsider the wording at that point. So I'm not suggesting we change the timing. I'm suggesting we agree after that 45-day period to go back and have that discussion.
So that's different. That
Okay.
is allowing the regulation to move forward in the rulemaking process.
But nonetheless, it does specify that there would be more opportunity for group discussion.
Absolutely.
Multi-party discussion.
Yeah, so once it's through pre-review, it is approved to be sent to OAL for notice, and that's when that 45-day comment period is established, and it comes back to the board to review public comment. I don't think that's what they want. I think what they want is to hold up the regulation, the entire rulemaking process to talk about it now, because otherwise we'll create a rulemaking package based on language that may substantively change.
But wouldn't that be then, it
Which
comes
we-
back to the
Well,
board
then-
where we could make adjustments to that language and continue the process forward that might incorporate some of their concerns? Isn't that a way to keep the ball moving? But
We already
rather than
know
starting
that they
over?
have concerns. So how do we write a rulemaking on this language when we already know that there's opposition?
Well, and I'm assuming that some of the consternation is because some of the actual facility requirements in the new regulations may be impossible for different facilities to meet. Is that correct?
Except I have to clarify, though, these are not new requirements on the shelters.
They're there
Right now, they are held to the current shelter minimum standards for fixed facilities. These proposed amendments make it easier for them to comply. So I keep hearing that we're adding new regulations or we're raising the standards. We're not doing that. I just need to make that very clear.
That
For
was my
example, the
concern. They're not in
radiology
compliance now.
radiology requirement
That's
is
my,
on-premise
You're not.
or off-premise. So we have expanded the opportunities for them to have in-house laboratory service or off-site, in-house radiology performance services or off-site. So we've expanded the minimum, or the ability for a facility to meet the minimum requirements. I agree with that, but, okay, obviously my suggestion failed. Okay, next suggestion.
So I think that, our goal here is so that we can oversee all shelters, and a premise permit allows us to oversee all shelters and make sure that they have some standard, and that, am I correct there?
I think our purpose is to oversee the practice of veterinary medicine to protect consumers.
Right, but I mean, it's so that all of the places that are depositories for animals have some oversight.
No, only if they are practicing veterinary medicine.
But the ones that are depositories for animals need to have vaccines and we want them to have vaccines and all of that. And so what I'm wondering, though, is, you know how we have the veterinary assistants that we now are getting registered and all of that? Is there a subset of shelters where they have to, for example, in Kings County, submit a proposal, and it's a license of sorts, and the vaccine protocol is overseen by a veterinarian, say, that has listed it, but they're showing that without having to have a actual premise permit. I think that the problem with some of these is that a veterinarian really is not, that is just 150 miles away, that they're bringing the animals to, is not going to put his license on the line and be liable for this shelter that he can't go to and doesn't, frankly, or she doesn't want to spend the time to go to because they're so busy where they're at. And so those specific cases, which I think should be few and far between, but maybe aren't as few and far between as we'd like. But in any case, these rural places aren't going to be able to get premise permits. I think that that's going to be really difficult, even in the best of circumstances, even if they had a lot of money to be able to pay people. People don't want to live there and be veterinarians there. So is there something we can create that has them show us, like, put a form and things that they have to meet that we are actually approving, like a premise permit, but is at just a different level for these specific circumstances? Is that something that's possible? Is that something we would want to entertain? Does that seem to be a possible solution, or am I just crazy?
Well, not only is it possible, but we already did it in these minimum standards. When we took this project on, we knew that there were going to be some shelters that were going to have a hard time doing this. Not that they don't want to do it. I know that you want to do it, but I know that it's going to be very difficult for them. With that in mind, I believe that we made every effort to make it as easy as possible for them to comply with minimum standards. So this is not a premise permit in the traditional way. It's a new premise permit, a shelter premise permit that, I don't want to, has lower standards, but different standards that takes into consideration the resources that some of these smaller shelters have, not many resources. A comment was made that, we're trying to do it, but we just don't need the board to do it for us. And unfortunately, that's not the way we view the practice of veterinary medicine. Just let them take care of it and have faith that they'll do it. That's not applied to any. Our job is to oversee the practice of veterinary medicine. And when you give a vaccine, you're practicing veterinary medicine. And it's the charge of this board to oversee the practice of veterinary medicine everywhere it's performed. It's not that we're being heartless and we don't understand your concerns, but there has to be some standards. And that's where they came from. That's where these regulations came from.
So I'd like to clarify, that was not an official motion that I made.
We don't have a motion yet.
But I also I agree with Dr. Nunez that, we are very concerned about protecting the consumer, the animal, but also providing the best service that we can to the animal. And it reminds me of a large animal practice where I might have multiple clients with vaccine protocols, intake protocols at feedlots, et cetera. I write the protocol for the year. That's my responsibility to write a protocol that's appropriate for the facility, but that facility doesn't need a premise permit. It's my license that is responsible for that vaccine protocol at, let's say, a feedlot or a cow-calf operation or whatever. I would think that concept might work in the very rural areas where it probably is only served by possibly large animal practitioners. And in that case, it seems as if their license as a veterinarian is what is responsible for that vaccine protocol that is written. And that may be an alternative, is what I'm saying.
And the other thing I would add is that this board did not make this policy. We gave it to the shelter community. We gave it to the CVMA. We let them make it. And we just approved their final product. I'm painfully aware of the concern of these 26 shelters, but a vast majority of the shelter community made these regulations. It's something that the shelter community wants as a whole. They made the regulations.
I think, Jennifer.
So I'm trying to find out how to say this without offending anybody, so this is not meant to offend. But I often have issue with these survey results because it even says out of the 102 sheltering facilities that responded, so I'm confident there are more than 102 shelter facilities. There was a great deal of discussion on this over the years. I was on the subcommittee toward the end. I wasn't involved in all of the task force meetings that were ongoing, but there was so much discussion as to the definition of animal shelter facility because there are some air quote animal shelters that were well-meaning individuals who just didn't have the resources and were basically practicing unlicensed activity. So this was never intended to reduce access. It was meant to make it easier for the shelters. And I worked in a shelter for 13 years, and we would often be inspected by hospital inspectors, and they would hold us to the standards of small animal practices, and it wasn't equivalent. So these standards were meant to make it easier for animal shelters. So out of these 26 on here, and again, not intended to make accusations, I don't know how many of these are. Now, our guests here today sound like the actual exception, the ones who want access and just don't have it, but I don't know how many of these 26 are. And when it was CACTA and SHAC, there were so many task force meetings, there was so much information, we discussed everything in great detail. And again, as Dr. Nunez stated, this was the product that came out of there. This language was changed so much to try and make it better for the shelter community, so I'm struggling with this.
I understand that this has been frustrating, and I don't mean this to feel like Groundhog Day for everyone. And yes, there was shelter input, and we're estimating there are probably 330 shelters in the state. The ones most likely to respond to our survey are our members who are better resourced. So I feel like we're probably estimating a minimum of a quarter of the shelters in the state are in a bind in terms of being able to find a veterinarian. We've got other shelters that, 75% have permits, and some have amazing veterinary programs going on, and we love that. And we're hoping to help use those programs to attract more veterinarians to shelter medicine. As we go forward, but I feel like the kind of train went in this direction, and I've got shelters freaking out now because the ones that are feeling left behind, like, oh no, what are we going to do? And do we need to stop vaccinating our animals? Is this going to be enforced now? And now we can't give any vaccines because we're just out of luck and don't have the resources. And that
we don't
would
want
not
that.
be a good situation.
We don't want that. Kathy.
I'm glancing at some of the quotes from the survey statement. I do also think there's some legitimate confusion out there in the shelter community about what this does and doesn't do. Because some of these quotes about, we don't have a vet providing direct supervision of vaccinations and things like that. I mean, that's different from what we're talking about here. So I think maybe some of the confusion and some of the concern out there is possibly misdirected because they're thinking what this is different than what it really is. I'm just wondering what the education has been like to the shelter groups in your organization so they understand really what this is really about versus thinking it's about something even more onerous.
We sent them your language to read. So whether it was misinterpreted, I can't say.
Okay, thank you.
It could be they interpreted a supervising veterinarian as having to be an on-site veterinarian, and that's not always the case. It could be. Mark.
You know, I'm proud of the minimum standards that were written for shelter medicine, and I think you would be too, because, like I said, we are in agreement that minimum standards should be there. And trying to think of, I think the biggest problem is resources in getting that supervising veterinarians oversight to write protocols and so forth. I was reading an article in the Times today about loan forgiveness for medical professionals because of the whole Medicare issue in California, that there's no doctors that are seeing Medicare patients, and the governor signed legislation that paid off their student loans if they agreed to commit part of their first 3 years to serving these underserved communities. I wonder if we'll have Kathy call the governor and see if we can, would that be a possible avenue that we could explore to maybe get loan forgiveness, to get veterinarians to help out these 26 shelters that really need help? Is that a possible solution?
Possibly.
Sunset would love that idea. It's a real feel-good idea.
It's not an uncommon problem in all professions in rural areas.
Well, and it's not an uncommon problem in veterinary medicine to have underserved communities at this point in California. Yes, Grant?
Grant Miller, CVMA. That concept has been discussed on kind of another level. Every county is mandated to have a public health officer through the Department of Public Health. Has CAWA considered legislation mandating a veterinary public health officer for every county?
That would be great.
Could that be a possible solution to your issue with these 26 shelters that don't have veterinarians?
I'm not sure how that works, so it sounds great.
We can help you.
I'm not.
It would basically just mandate counties to have a veterinarian on payroll, which, you know, if every county, if every municipality is mandated by law to provide intake services for stray animals, then why not have legislation that mandates a veterinarian on payroll for the county?
What if you had a really big county with dozens of shelters in it?
I mean, these are all things that, now those are good questions, right? Those are good questions because there's a way to bring it up. So the exemptions that you're asking for, what that's going to do is bring it down. Because what it's going to do is it's going to take, so you said there are 330 shelters, there are 26 that don't have a veterinarian. If those exemptions go through, the other 300 are going to say, we don't need a veterinarian. You disagree with that? I think that when budgets get tight and when money has to get cut at the county level, I would think that that would be something that they'd look to say, we don't have to have a veterinarian here to do this. All these things that we're doing on a daily basis that you had in your exemptions, we don't need a veterinarian for that anymore. And I think that that will arguably bring the standard of care down for animals, which to me that does not seem to be in the best interest of all the parties that have been in conversation about this over the years. That does not seem to be what anybody wants, but that seems to be exactly what could happen if we went that way. So just another idea.
I mean, I would say anyone who, deals with populations of animals, there are so many that get sick or injured, it would not behoove a shelter who is able to have a veterinarian to decide not to, because then they're going to have to outsource that to a private practice that's going to cost more. So I really feel strongly that the shelters that are able to have a veterinarian in-house are absolutely doing that because it makes sense from a cost perspective than paying a private practice rate for that. And we don't want to lower the standard, and that's, and that's why we didn't include testing and other things in here. We're just talking basics and especially for some of these rural shelters that don't have options, like get a vaccine in them, do the stray hold, and then get them out to a shelter that can take care of them well.
Any other comments from the board?
So I propose, seeing where our proposed regulations are, that we not do anything about them right now. However, I would motion that we create a new task to the MDC to possibly explore the option of legislation to find, I don't know how Grant put it, just assign a veterinary, public health officer to address the concerns that have been raised up today.
That sounds like a motion. Is there a second? Oh,
I
Jessica.
have just a suggestion, because I think that sounded like a really fantastic idea, but there might be other ideas that come up. I think there's been a couple that come up today. So maybe not limit it to that specific solution, but maybe look at other solutions.
Like loan forgiveness?
Right.
Yes, absolutely.
Right, improve underserved.
Would you care to amend your motion to include other?
I do. I
Okay.
accept.
A second for his motion?
Second.
Kathy, second.
Sorry, so clarification on the motion then. It's really to task the MDC with trying to identify ways in recruiting more and requiring veterinarians for these shelters.
Well, to address.
Facilitate.
More
Yeah.
assistance.
to encourage ways of these underserved communities for veterinarians to help serve in these communities that need help.
Okay.
And that one possible way to do that is by assigning a veterinary public health officer, and another possibility would be loan forgiveness, all those
Look at all
possibilities.
Who was the second? Okay, and just to clarify, the regulation proposal will continue to move forward.
I would, yes.
I guess I'm just still concerned, what are these people going to do, like in Kings County? And it's not all of the shelters, but the Kings County type situation. If this passes while we're trying to figure out all of this stuff, is there something we can, in
So
that
just to
MDC?
clarify, there is already regulation that is more onerous than the one that we are moving through regulation right now. So it's not,
So they don't really need to worry about that right now because they're already breaking the law?
Right now, they're
Is what
practicing.
kind of
Yeah.
what we're saying. So there's no need to put like a temporary, okay,
And
thank
this-
you.
And this is a long-term process. Ours are a long-term process to get changed.
Okay. Thank you.
So we have a motion and a second. Are there any public comment for that motion? Dr. Nunez can.
I cannot. And the motion, in a sense, is to address the concerns that have been brought forth before us. Would you have something? Oh, go for it.
Let me know if this is right. Send back to the MDC to identify ways to encourage veterinarians to recruit to underserved communities. One way being to get a veterinary public health officer, loan forgiveness, et cetera. So that's, I just kind of summed it up.
I think I would say more like task the MDC to look at alternatives and solutions to the current problem with underserved shelters in,
Specifically to address the concerns raised today
yes.
of the inability, due to lack of resources, to comply with these proposed regulations or with the current law.
I have another wild idea, too. We have several veterinary schools in the state. Maybe they could develop programs for their senior students on externships to teach them how to write protocols and
Yeah.
do things. And
Because you're right, by imposing these regulations, we are essentially tasking you to do something and not giving you resources to do it.
We would love resources.
Yes, and so the ultimate goal is to provide those resources.
Mark, they already have the regulations. We're
I
not
know.
giving them new
We're making- yeah.
regulations. Giving them more,
They're not complying with those regulations now, and they're not going to be able to comply with the reduced regulations. So we went down a little bit, and now we have to help them come up a little bit so that we can reach the level where we'll all be happy and the pets will be healthier.
Thank you very much.
thank you very much. We really appreciate
We're
you
still
coming.
friends,
wait.
right?
We still need a vote, though.
Okay, looks like we have a motion and a second. Who seconded? Kathy, okay. Call for the vote.
Ms. Bowler?
Aye.
Dr. Bradbury?
Yes.
Ms. Laredo?
Yeah.
Dr. Nunez?
Yes.
Ms. Prado?
Yes.
Dr. Waterhouse?
Yes.
Dr. Noland?
Yes.
Motion carries.
Okay, we're going to move back to number 8 on the agenda. Update, discussion, and possible action related to pet cremation services. We're going to invite Dennis to come forward again. Thank you.
Hello again, Dennis Cuevas Romero with the department. Wanted to provide an update on where we are on pet cremation. If you all recall, there was a constituent that was before this board, I believe in December or January. Cemetery, the Bureau, the Cemetery and Funeral Bureau is currently going through its sunset year, and in their sunset report, the committees, the joint committees, put a issue related to pet cremation, and essentially tasked the Bureau with doing additional research on the issue. We had conversations with Senate Business Professions and Economic Development, and informed them of the interest and the ability for both programs, both the board and Cemetery Funeral, the need to look at, get more information and seek more research on the issue before DCA and both programs could make a commitment to looking further into the issue. Where we are at this moment, the board, through the executive officer and the bureau chief at Cemetery Funeral, new chief Gina Sanchez, provided DCA information about the number of complaints that both programs have received, information about other states that potentially regulate in this space, and potential costs of creating a new program under the department. Our hope is to finalize a letter that will be shared with the board, the bureau, and both committees in the legislature. Hopefully in the next month. We are still seeking a little bit more of information because we don't quite know the universe of businesses that provide these services, and I think that is very key. It's really essential information when considering addressing this issue. So we are fairly close. We have the bones of a letter to be submitted to the legislature, but we're not quite there yet. I will say that in doing this research, it's my understanding that only 2 states provide regulation in this area. And it's also my understanding that the board and Cemetery Funeral has not received very many complaints on this issue. So I will just note that the previous administration, when creating a new program, made it very clear that there needed to be clear consumer harm before tilting up a new program, creating licensure or regulatory authority. We don't know how this new administration is going to feel about creating a new program, but I will say that we probably need additional evidence to tee up a new program under the department, whether that's a standalone, under the board, under the Cemetery Funeral. Again, the legislature will do what it does, and our job at DCA is to implement. So at this point, we are trying to provide a fairly comprehensive letter and report, I would say letter, not a report, to the legislature, providing context as required by the sunset report for Cemetery Funeral. So happy to answer any questions if there are any at this time.
In the research, yeah, I agree, it's difficult to wrap your arms around this if there aren't areas where you can actually go to find the degree of problem. But I assume, obviously, with the complaints with the cemetery board, but does the Better Business Bureau and other agencies that take complaints about businesses that do not perform according to what the client expects, are those areas where we can also derive data?
Yes, there is, and we are taking a look at that internally. Again, it's really challenging to know what you don't know, for example, but we're trying to get as a comprehensive look as we possibly can. I think that's the challenge in itself, that we just don't know how big or small this industry is. So, and oftentimes, again, that's why there's a threshold in terms of the need for data and clear evidence of consumer harm before creating a new program.
Any other questions?
It's hard for me to understand why the cemetery board would not want to really take this issue on. It's clear to me what the practice of veterinary medicine is, and that's what we oversee. When you cremate a body, it's clear to me that that's a crematory service, and I don't understand the hesitation that the board has to not want to regulate that.
So two clarifications. It's Cemetery Funeral Bureau, so they are directly under the purview of the department, so similar or not similar to a board where a board is semi-autonomous.
I know the difference.
Yeah, just wanted to make that clear. I think the way the laws are currently written for cemetery funeral, you can only cremate a body or a flag. And there are stakeholders that would be very hesitant and probably strongly opposed to commingling a body with an animal. Specifically, we've heard that particular religious entities would be very strongly opposed to this. I don't want to say that in itself says that the Bureau is not looking into this, but because the way the laws are currently written, that's
So a dead cat or a dead dog is defined as not being a body?
Human remains.
Human. And I would say, just based on, I think basic knowledge, I bet that it is a big problem, and I bet there's a huge thousands and thousands and thousands of consumers in the state that do engage in pet cremation services. So it is kind of a hole there if we can figure out how to regulate it. Seems like it would benefit consumers immensely.
Dennis, during our meeting, we had talked about any kind of potential opposition if one board or the Bureau would take it on. And that's when Gina Sanchez did make known the probability for extreme opposition because of the potential mix of human versus animal. It even went so far as to say, and please correct me if I'm wrong, but so far as to say they would want separate staff handling those complaints. They don't even want the same staff handling the same issues, to where it was extremely, it wouldn't be met with a lot of opposition. And then one of the questions that was asked of me, which I'm not sure I could answer, but maybe the industry here could, is would we receive similar opposition if, say, we do start regulating and they are self-funded and veterinarians aren't paying for it and it goes under the board? Would the industry or the board have similar opposition to that?
If we regulated it?
I'm just saying hypothetically, because that's the known opposition that we would get under the Bureau. I'm just curious to know if that's a similar concern that we would have. I think my primary concern that I've heard from the board is, one, veterinarians shouldn't have to pay for this service because they don't do this service. They're not the experts in this service. Our staff are not experts.
Right.
That's all learning curves. And so I think it's more if there was a mechanism for this board, and I'm not proposing this, I'm just saying if there was, for the board to obtain whatever funding it would have to do, which is a lot, to start up this brand new program, and we made it work to where it was separate, are there similar opposition from this side?
Christine had her hand up first.
Well, I would be strongly opposed to spending my time and taking days off work to regulate it's a different type of opposition, but I don't know that I would continue on as a board member if I were asked to also oversee pet cremation. It's not, has nothing to do with my job, my knowledge, and it would be the time that I would be taking to look at that. I don't think I would be willing to participate as a board member.
Cheryl.
So I would be opposed. I think the natural place for this would be in the Bureau, as just because that's what they deal with day in and day out. But I'm curious how they jump from them possibly taking over pet cremations to commingling ashes. How did that jump happen?
And
What's one, that's two totally different
I
things.
think they meant the staff that would deal with two different entities. Isn't that what you meant? The staff would have an objection?
Also, isn't there
I
separation
think-
of
I think
church and
it's-
state?
I believe it's both, and my understanding is that the retorts that they use for cremating a human remain or a flag, that they would need to essentially have two separate retorts, one for human remains and flags and one for animals.
Okay, so we're not asking that the current facilities that cremate people, we're not asking them to do animals. We're just asking them to oversee the facilities already that do animals.
Understood.
Okay.
And we assume they only do animals, these
Right.
ones.
So when you're referring to staff, you're talking about the staff at the Bureau, not the staff at the
Correct.
facilities.
Correct.
And that's for religious reasons?
So, again, my understanding is that it's more of an issue related to the separation of the retorts and making clear that they are two separate items. I think that's the biggest sticking point. Again, in terms of the perspective from the Bureau, their laws, similar to the conversations you all have on the limitations of your statutes and regulations, their current laws would not allow for that.
Thank you very much for your time. Appreciate it.
Is there anything else that you need from us that you would like us to provide input on?
I may ask for potential reach out to your vets, your licensees, to try to figure out what this universe is, because again, our understanding is that oftentimes, sometimes a consumer does do their own research to find a pet cremation, but my understanding is most times it's through a vet after, the animal dies. So we have considered that maybe vets would be able to give us, the top 5 or 10 companies that they use or that they are aware of.
One.
Top one company.
Yeah, it's not that there's that many.
That we can do some additional research we're doing on our own, but as vets, you all are, on the ground and you see this a lot more often than we do. So that may be an ask that I could potentially work with your executive officer. But at this point, I think we are at a point where we're pretty close in finalizing the letter that we will be distributing to the legislature.
Have you considered doing a survey of veterinarians just to see if they think there's a problem? I haven't seen a problem.
And again, I think that leads to the fundamental question about we have not seen evidence of, sufficient evidence about consumer harm from either veterinarians, this board, or cemetery funeral.
Cheryl, you saw a problem 2 meetings ago when that consumer came.
Yeah,
and
well,
pleaded
that
her
would be the
case.
only one I know of, yeah.
Wasn't me.
Weren't you at that meeting?
Okay, Jennifer has a comment.
To answer Jessica's question, yes, I would be opposed to it because this seems to be a business
Jennifer has the
issue,
floor.
not a veterinary medicine issue. So
I'm
I
sorry,
would be
go again, Jennifer.
I would be strongly opposed because this is a business issue, not a veterinary medicine issue.
Okay, thank you very much, appreciate your time, and if you need anything else from us, let us know.
Thank you.
We're going to take a 5-minute break. Thank you, we'll be back. Does anybody ever complain to you? I don't mind that, I don't know. Housekeeping. Christina's told me. Due to, in the interest of time and because of the people that are here to give their reports, we're going to go ahead and jump down to item 15B, a budget report, and then we're going to jump back to agenda item 11 after that. So thank you very much, and we'll turn the mic over to you.
Okay, thank you for having us. My name is Karen Munoz. I'm the budget manager for DCA. I do want to take this opportunity to introduce, you do have a new budget analyst that's going to be assigned to the board. His name is Bikram Dalawal. I will be meeting with Jessica and other managers to kind of do a more formal introduction, but he is here today to kind of see how this kind of forum runs, to introduce him to what he has to look forward to.
You might want to pull that mic a little closer to you there.
That better? Okay. So today we're going to go over, we just ended the fiscal year 18-19. Right now you guys have a projection through, using data that we pulled for fiscal month 11, but I did project you guys through the entire fiscal year. So I don't see any changes or any room to move any numbers around or anything. I think we've solidified your 18-19 budget and where you guys are going to stand in 18-19. We do have a reversion in 18-19, although this year is a little tight due to some unforeseen costs and enforcement, and I'm sure you'll go over those later. But there are no troubles this year. I don't foresee any next year. We will be working closely with Jessica and Monel to really tighten up projections starting at the beginning of this fiscal year, so we have a better understanding and we don't run into any complications in 1920. So the document that's up on the screen right now, that's our fund condition statement. Looking at your fund condition statement, you guys have a balanced fund. So when we look at this, we're looking at the dollars that are coming into your fund. Those are based off of renewals and licensing fees, and then what you've expended. And by doing that, you do have a balanced fund going into 21-22, looking at everything as is. When I say balance, like I said, it's pretty even. You know, there's a small difference in your expenditures. You might be expending a little bit more than what you're bringing in one year and expending a little less. So it balanced you out. We have a 3.4 fund balance in 21-22. Once we dip below that number, we do discuss with the board on some options that we might need to take, whether they be fee increases or and this can go the other direction too if you guys go way beyond a 24-month cap on your fund reserve. Then we look at it the opposite direction. But right now we have a 3.4 month.
How often does that happen?
Usually. For VetMed, I haven't seen it. But there are some boards out there that do kind of like to keep their reserves at a much higher level. But for us, our purposes, we would like to see you within a 3-month range. So once we go below that, we definitely speak with the executive officer to discuss any options that we need to do moving forward, and those are usually via a fee or a fee increase.
So we have a fairly large backlog of investigations and cases, and complaints continue to rise on a monthly basis, or at least a quarterly basis. So we do foresee that we are going to, at some point, need extra staff to remedy that. When does that come into consideration? I mean, you're mentioning that everything is status quo right now and will be for the next couple of years, but if we just stay at status quo without hiring more help,
Right.
we're going to just bury ourselves, I think.
So in terms of your fund, when the things that could tip your fund to below the 3-month range are budget change proposals. So if you guys are going to seek a budget change proposal, that needs to be understood that when we insert those numbers of what you're requesting, those resources, so if you need dollars associated with those positions, that will then impact the costs. Your costs will definitely rise, your revenues stay low, we would need to address a fee increase at that time.
Okay. Questions for?
We're going to be going through sunset review pretty soon, and I expect there's going to be certain expectations that are going to be asked of us that's going to result in us having budget change proposals because of the number of complaints, the time that these cases are being kept open. Our hospital inspections is not where it needs to be. So we probably are going to be requesting those BCPs after we get through being spanked at the sunset review process. So do we just deal with that when it happens?
Right, so when you get direction usually from the legislature, whether it be you definitely need these resources, it does make your case for a budget change proposal a little bit more stronger, but we always have to look at your fund regardless. So when you're going through your sunset review, that's just another caveat that you have to explain, and you got to go over that. If we add these resources, then your fund will then possibly dip below your zero. You will have you'll have a negative fund balance, and when they see that, I mean, you definitely need to seek a fee increase sooner, which is why we look at your fund balance in years in advance. So we project out to kind of see where we might see you at, 4 or 5 years down the road, if you guys are anticipating or toying with the idea of increasing fees at that time. So we would look at, so if you're, depending on what the resources you guys are requesting. So if you're asking for additional positions, no dollars, that's not going to impact your fund at all. However, when we add resources and stuff, when we do have an AG increase as well, so that will impact the fund, so we have to keep that in mind. And so these are things that you bring up to the legislature during your sunset review. But there was part of the things that are impacting the fund. Yes, we asked for a fee increase, but there are small changes to the fund that we will need to review just based on, I think we have a $70,000 reduction that we need to do in your revenue. So there will be small incremental changes that we need to make to those areas when we start doing your projections in future years out for revenue. But fee increase, you just went through one a year ago. So it's a little bit more difficult to take that to the legislature to ask for raising the caps at that time. But we do have some small areas that we could increase.
What about after the DCA meets with the VMB in regards to the salary study, and it's determined that we need to double Jessica's salary? How is that going to affect our budget? Does that qualify for BCP?
Take the chocolate.
What happens then?
That won't get through.
I mean,
I do have a question.
every year there's an increase to your appropriation via small incremental changes. We have employee comp changes and rate changes, retirement rate changes. Those incrementally adjust your budget every year. So if salaries do get raised, those are going to be captured in those drills every year. But if there are things that the boards have decided we need to push this forward, it's to keep in mind we are going to need to raise fees at that time, and then we have to take that depending on where you're at. So if you guys are at max cap, then we need to take that to the legislature, and you have to find first-year author and everything.
So my question for you and Jessica, do we need to look at the statutory caps on some of the license fees? Are we at statutory caps on some of them so that we might need to incorporate that at sunset review?
No, we're not at statutory cap for many of our fees. I think it's no secret that we need significantly more staff in enforcement to keep up with not only the backlog, but the increased complaints and the complexity of the complaints. I know that we just went through a regulatory fee increase, and it's never ideal to then go back and do another fee increase shortly after. But we can't maintain status quo right now. We just can't do it. So while this fund condition is showing okay-ish, I think that it won't be soon because we need more staff, whether it's limited term or permanent. But I just want to put the board on notice that I definitely expect us pursuing fee increases through regulations. I need to work more closely with budgets to see what that looks like if we were to raise all of them to the caps, what that would do. Based on that information, then we can go to legislature and say whether or not we feel that the caps themselves need to be raised. So I think I need to work more with budgets before we provide that input to the legislature.
Just as a theoretical question here, do you wait until you're at the cap and then ask for the cap to be increased, or do you kind of plan ahead and raise the statutory caps as you increase fees?
Yeah, I don't think we want to wait until we're at the caps to ask.
Yeah.
But I think before going for that ask, we need to know how far it gets us to raise us there.
Right, and I'll just add, though, on top of what Jessica said, that she will work with us, and if you guys are at cap on some of the levels, we could work with scenarios going forward and where you guys would need to fall on and keep yourself solvent. So if you're at cap at a certain range, if we need to increase that, we can do some scenarios to see where that would fall. So we'll work closely with Jessica on that moving forward. We are under the standing that you guys do need the resources.
I have a question about regulation review. The board currently has 8 rulemaking packages in budget that have been sitting there since the beginning of April. And I'm wondering if the transition will further delay any of that review.
So I know that I do have, I apologize, I do have some regulations on my desk. I have actually had Vikram work a few of them. Just to kind of, giving him a little bit of a transition into regulations. He actually reviewed them, and I think he gave a very positive analysis of them. We just need to go back and clean them up a little bit more. There are some questions back with the board for me to finalize those as well, but I'm not sure if we have 8 total still on our desk, but we do have probably 5 or so still in our office that we are working to move them out. We are working on some more, I won't say more priority regs, but we do have, they understand that we do need to get the AB 2138 out of our office more on an emergency need, but we are pushing them as fast as we can. And it is not the anticipation that the transition will hold it any longer. They are moving, and I'll work with the board to get those out as fast as I can.
This may not be a question for you, and I can't find in my notes where I saw this, but it seemed like Breeze was costing us I don't know, $250,000 a year, was that, did I misread that?
I think in the draft sunset review report, there was a question specific to breeze costs and what the board was paying.
Okay. Can I ask you, has it been across the board with other boards that the breeze costs are higher than we anticipated, or is that what we had anticipated?
I cannot answer this directly to Breeze. I don't have that expertise in it. I could get you an answer for you, though. I can forward that to Jessica and send that over.
It would be helpful, I think, to us to know if that has been an issue in other boards, or if there was some sort of anticipation of the costs that have been different than we thought they were going to be.
Understood. We'll get those over to you.
I think, and actually, this is more on the detail budget on the other side, because Breeze was contained in one of these line items in the past. I don't remember which one now, Ethan, but I don't know if anyone here knows.
The Breeze costs are broken out through a couple of the line items.
Mm-hmm.
And so it's not specific. Other things also hit those line items. And so we can't, it's not specific.
Any other questions?
Yeah, I do.
Yes.
I had a question on our budget report, which I'm not sure who it addresses to, but to everybody here. Where we had on the expert witness, subject matter experts, the SMEs, it looks like we didn't budget for them, but obviously we had a big expenditure for them, so there's a big negative. Is that normal? Don't we normally budget for SMEs?
So I didn't print out that one. Which one are we referring to?
Oh, it's down, it's on this one, farther down, under,
I think, yeah, it's under,
yeah, right there. There you go. A little lower,
Right.
yeah.
okay,
The
so
170,000 down here. SME experts, subject matter experts, and there was 132,025.
Down here?
Yeah, right here.
right,
Yeah,
I see,
yeah.
yeah. So we don't have,
So it's right here. but
right, we don't have a specific line item budget for that at this time. We are working to true up a lot of these budgets to where we are actually expending and putting our costs at. When we're at that point, we just look at bottom line. And so if you are expending in a line item that doesn't have a budget assigned to it, as long as you make savings in other line items within your budget, it's fine. But we do understand that the board members want to see where they're actually falling. And so we are going to be working to true up these actual line items in the future to where they're expending. I think we're actually working diligently on that right now.
And to clarify, just to add on top of that, I don't think it wasn't that the board hadn't budgeted for it in the past. It was coming out of different buckets within different line
I
items.
was wondering if this was having something to do with the
yeah.
fiscal new.
No, it's more of our desire to make it more clear. For example, you take the subject matter experts. Well, we have subject matter experts for examinations. We have subject matter experts for enforcement. And then we have you have a line item for evidence witness fees. What was happening is, depending on where it fell, it might have fallen into a different bucket. And so we were really trying to also separate the subject matter experts for inspections versus subject matter experts for enforcement and examinations. So it's just falling out of different buckets. It's not that it wasn't being budgeted for in the past.
Yeah, because I thought it was, and that's why I thought this one wasn't unusual.
Yeah,
I'm not sure.
we're working with the budget office to
Okay.
make it more clear.
Sorry, any other questions?
Public comment?
Public comment?
Thank you so much.
No problem, thank you.
Thanks. Okay, now we're going to jump back to, I think, item number 11.
11. Oh.
So members, I'm going to ask Amanda to provide a brief update on the status of pending regulations, and then I'd ask that we hold on, when we get to the update on compounding, because I understand there's some people from the audience here who want to speak to some concerns that's related to the compounding.
Okay, so I'm going to do a brief update since the last meeting. So in the public packets, there should be an updated flow chart that says at the bottom 710 for the board members. I physically left that on your desk, so it says update July 10th. So the update since the last meeting, the fee schedule that you see there at the top, the certificate of compliance was approved by OAL on April 17th. So this regulation is now permanent. So that one is absolutely done now. The Cpi Regulation Package, that one has moved pretty far since the last meeting. So the comment period has been concluded. The final rulemaking package was completed and submitted to OAL on June 24th. So I'm just waiting to hear back from them if it has been approved or not. I believe they have until August 1st to get back to me on that. The Telemedicine Regulation Package, we're going to be discussing that a little bit later here. That comment period did end on July 1st, so that one was noticed by OAL on May 17th. And then the regulations for AB 2138, that's the substantially related criteria regarding criminal convictions. That's the other one that's changed quite a bit. Those also have been noticed by OAL, and they are currently in the 45-day comment period. That 45-day comment period will close on August 12th. The rest of them, there hasn't been too much change. As Tara noted, there's been quite a few of them that are just kind of hanging out right now. So that's all that's changed so far. Is there any questions for me?
I need some clarification. What does it mean by is with budgets? Is that OAL budgets or what?
So what that means is you can see on there the date that I submitted them to DCA. And the first part of the DCA process is they go to budgets. And what they do is they analyze if there's a fiscal or economic impact. And I, myself and Tara and Jessica will work with them, and if they have any questions, we do our best to address any concerns with them. Thus far, they've come back to me with APR, and Jessica and I met with Karen, who you just talked to, and addressed some of her concerns with that. And I gave it back to her. I haven't heard anything else regarding that, so it's still with them. And disciplinary guidelines, she did have a few questions for me on that, and I did meet with a couple people in enforcement because it's predominantly regarding their realm. And I am working on answering her questions with that. I just got those questions from her about a week ago. All the other regulation packages that are with budgets, I haven't received an update from them. So that's what it means when it's with them. After budgets, I do believe it goes to legal affairs, if that is correct, Tara?
Right. So initially it comes to me, I just confirm that it looks exactly like the pre-review package I approved. Then it goes to budget, then it comes back to legal affairs for review by my supervisor and the deputy director of legal affairs. And then I believe it goes to the director's office. And then it goes back to you for submission to OAL.
Then I just have one other question. If you look under the veterinary technician education one, is that a typo, the date? It said has been submitted to the DCA on the 3rd, on March 26, 2016?
2018.
18, okay, thanks. No, I'm just curious. Well, or is it 19, because you amended it on 8 of 2018?
No, I submitted that.
Language was amended in August of 18.
No, it was 2019. I apologize.
Okay, thanks.
2019.
Okay, thanks. Any other questions from it? Yeah.
I don't know if anyone that's long-term with the board in a gubernatorial change, administrative change, should we expect that things submitted to DCA for review may take a little longer because of the changing in staff, or is there a time period that we normally would get things back, that they have to in that review period. I'm just wondering if that, in an administration change, makes a difference. And I don't know if, Jessica, you've been through many of them.
Yeah, I've been through a few governor changes, and in my experience, haven't felt that was really a hold up to the process. I do want to mention one more step, though. After DCA Deputy Director of Legal approves it, it then goes to agency for review, which also takes some time before it goes back to us and submittal for OAL for posting. So there's more review in there.
Okay, any other questions for Amanda? Okay, we have Dr. Sullivan, public comment.
Thank you, Dick Sullivan. I just wanted to update the board on U.S. Pharmacopoeia's revision to their non-sterile compounding preparations, the preparation guideline 795.
Oh, I'm sorry, I just wanted to clarify, members, we're speaking to this because it's listed on the status of our drug compounding regulations. So that's on page 4 of 9.
Oh, okay, thanks.
And also their sterile compounding preparation guideline 797. This is relevant because in our regulations, that's what we refer to. We began discussing veterinary compound in 2015 by writing a statute that allowed us to write regulations to compound, although we have been doing simple compounding forever. The statute is 4826.5 and went into effect on January 1st, 2017. When we wrote our regulations to allow veterinarians to do simple compounding, we were relying on U.S. Pharmacopoeia's classification of simple, moderate, and complex compounding. After 3 meetings, and I think it was a couple years involved, meetings with the Board of Pharmacy, we were able to convince them of the fact that we were not expanding our scope of practice, that we have been doing simple compounding forever, that because we were dealing with patients that could be under a pound of weight and as large as an elephant, we needed the ability to change the concentration of medication and mix medications for proper delivery. We gave them specific examples of what happens if we are unable to do simple compounding. The end result would be a decrease in safety of the drug, or we would be unable to control pain, or in some cases, actual death of the animal. We were able to convince them that we needed this ability. As you can see from the chart, our compounding regulations are still progressing through the system. In early 2018, CVMA noticed that U.S. Pharmacopoeia was updating their guidelines. This is important because FDA often takes their guidelines and simply adopts them as federal regulation. The first thing we noticed is that they removed the classification category of simple, moderate, and complex. Fortunately, Tara would not let me use the definition of simple compounding with a footnote to reference USP 795 in our regulation. Instead, she made a definition that could stand on its own. In April 2018, the board, along with CVMA, AVMA, and a number of state associations, wrote letters to U.S. Pharmacopoeia expressing our concerns about how their changes would affect the day-to-day practice of veterinary medicine. By the way, there were no veterinarians on this committee of theirs. About a month ago, they just released their guidelines, and although they made some minor changes, the end result is the same as we feared. Dr. Grant Miller put it best. These regulations have now put the veterinarian in a position of either not being able to provide urgent and needed treatment to relieve pain and in some cases to prevent death, or they will have to break the law to treat their patients. It comes down to simply that. To make things worse, AB 973 Urban was introduced this year way before the guidelines were finished, that states that U.S. Pharmacopoeia guidelines will be accepted as law in California. In California, we felt that veterinarians were not considered compounding pharmacies, and that might give us a little leeway. but U.S. Pharmacopoeia specifically states that veterinarians and veterinary facilities are included. CVMA has written another letter to U.S. Pharmacopoeia emphasizing the day-to-day results of their changes, but in the past, U.S. Pharmacopoeia has stated that they only make guidelines. If we want exemptions from regulations, we would need to discuss this with the regulatory agency. Definitely passing the buck because they don't want to deal with reality. I will keep you updated as things develop, and along with CVMA, well, they're not here anymore, but if there's any questions, I'll be more than happy to answer them or cover them during a break.
Thanks for bumming me out.
Wow, yeah. What would be your suggestion to be proactive here, Dr. Sullivan?
Well, what we're proposing, as a matter of fact, 2 staff people from AVMA are going to be meeting with the U.S. Pharmacopoeia staff this Friday, and we think that they're going to feel that they've bent over backwards to satisfy us, but they have no clue what we do day to day in a clinical practice. So they are going to re-emphasize what our concerns and conditions are, and hopefully we'll get a letter from them stating that they don't agree with us and declining our request. And if they do that, then we'll have a letter stating our concern, their response, to be able to go to FDA or state agencies and say, we need some relief here. In those meetings with the Board of Pharmacy, it wasn't until I gave them specific examples of how animals wake up from an anesthetic if we don't add that 0.035 milliliters of acepromazine to ketamine and Valium. They wake up bouncing their head off the ground or off the cage. So once we gave them examples of how we needed this compounding daily, all of a sudden they cringed and they said, do your regulations and then look at it again in 5 years and make your tweaks. But they understood. I don't think a group of pharmacists sitting in a room that probably doesn't have any windows is going to make that connection, but maybe. So we actually asked them for an exemption. We asked them to write a special code, another section of code besides the 795 and 797 to address veterinary compounding issues, and they declined. We asked them for a total exemption, and they declined that. So that's where it's at.
Can I ask a question on the legislation? That passed and was signed? The AB,
whatever.
whatever.
It's the author or the sponsor is the Board of Pharmacy, and
it's Assembly Member Irwin, you said?
Yes. And we didn't get the results of, that was introduced in January. We didn't get the results of the guidelines until 2 weeks ago. So they weren't even published before this is well through the legislative process.
So, okay, and this is now in the Senate, probably approach if there's...
I didn't look up exactly where it was, but I didn't see any. When I looked it up about a month ago, there was absolutely no opposition to it.
Is there any, because I don't understand the whole FDA, well, not the FDA, whatever the, nationwide system is, but is there any legal authority for that bill to be amended to exclude veterinarians from the mandate of accepting the...
I think the problem
Probably
is
not.
I think it's a little too early to ask for that because these guidelines have not been approved yet. As a matter of fact, there are human compounding pharmacies that are asking for exemptions on the beyond use date. We use expiration date. They're very rigid on a definition of beyond use date, and I've read that sucker 100 times, and I can't see the difference, but they're very insistent on that. And there's a group of, a very large a group of people that are objecting to that definition that have a lot more power than us. We're a really, really small group in this whole picture.
So we oppose other legislation. Do we at least oppose this?
I would feel uncomfortable recommending that at this point.
Okay.
I think
That's the
if
status.
we don't, if things go really bad, I mean, the problem is the guidelines have not been finalized yet. It's still in the process. So I think we need to wait for that to work out, and then if we may need to come back to the pharmacy, Board of Pharmacy, or this board. I don't know what process we have, but it will then change to regulatory. And the first one will probably go to is FDA.
I've got the text of 973 before me, which is already back in the assembly for concurrence and amendments. So I don't think we would need to oppose this. This adds a statute to the Business and Professions Code, the pharmacy law, which is specifically aimed at the compounding of drug preparations by a pharmacy for furnishing, distribution, or use in the state shall be consistent with standards established in the pharmacy compounding chapters of the USP. And it authorizes that board, pharmacy board, to adopt regulations to impose additional standards. So I think we're okay.
I don't.
Okay.
Because in the U.S. Pharmacopoeia, right in the introduction of scope of practice, it says it includes veterinarians and veterinary facilities.
Right, but in this case, and under our law, this is only aimed at pharmacies, compounding in pharmacies.
Well, we actually, and that's been the verbiage all along.
Yeah.
But we still had to get their okay for veterinarians to compound. So it hasn't been, in my opinion, it isn't clearly defined. I think that the Board of Pharmacy could interpret that if I am compounding and giving a product to a client, that I am a compounding pharmacy. I don't have that in writing one way or the other, but I'm nervous.
So, perhaps this is just something we need to keep our eye on in the sunset process in case we need to bolster our statutes.
Excellent idea.
Thank you very much.
Thank you.
Nancy Early, California RVT Association. I just have a question about the veterinary technician education regulation that started in February of 2015 and is still pending. It's about halfway through the process at this point. One of the provisions of this regulation changes the alternate route. It eliminates the ad hoc alternate route, and it starts accrediting alternate route programs. I recall that the date of implementation of elimination of the ad hoc alternate route was changed to 2024 because of the delay in getting this regulation implemented. But I'm just wanting to know if you have any idea when this regulation may finally go through so that we can tell people what to expect.
Nancy, I'm trying. I'm trying to make sure that these packages, all of them, including this one, which is number 2 on the list of what's sitting in budget, I'm trying to get them ushered through the process as quickly as possible. Because, ultimately, all of these are important, but you're right, VTE is also important, but it's still sitting under the disciplinary guidelines, which is hugely important.
Is it going to be 2024 before it actually goes into effect?
I hope not.
But it could be. So, okay.
You moved it from 16 to 19. Yeah, there you go. Okay.
All right, let's go to 11B. I'm going to turn this over to Amanda.
No, 11A, isn't it?
B. 11B
We
is
just
in
did
boy.
11.
No, we did 11A, pending regulations.
Well, I thought we did B early.
No, 11B is related to sections 2027 and 2027.5.
Okay, I thought I was, okay.
Okay. So I'm just going to provide a brief overview of the history, and then I'm going to turn it over to Tara for a little bit more information. So Tara talked briefly about this at the last meeting in April. So in January of 2017, the board looked at existing regulations that authorized DVM graduates to work as an RVT without obtaining registration. Last year, legislation passed that closed that loophole, and that was under SB 1480, and DVM graduates must be board licensed on or after January 1st of 2020 now in order to perform RVT health tasks. Today before you, there is language for CCR 2027 that the board did previously approve, and there are amendments to reflect that new statute for your consideration review. And with that, Tara, is there anything else you'd like to add?
Can I clarify what you just said, though? You said that DVMs, you meant students, right? DVM, you meant veterinary medical students.
Yeah, yeah.
There's not really much for me to add. We went over this at the last meeting. We made the changes that you requested, which were to 2027.5, which now creates a new provision for graduates of veterinary colleges. They were previously included under 2027 and authorized to basically do the job tasks of an RVT forever. So now under 2027.5, this sets out what a DVM graduate can do if they do not pursue a veterinarian license. This sets out their eligibility for RVT licensure if they so choose. And importantly, it's the time frame that we focused on at the last meeting. So right now, this proposed regulation would authorize any person who receives a veterinary medical degree from a recognized veterinary college or a person who is within 2 years of his or her anticipated graduation from that college to be eligible to apply for the NVTE and CBTE. And the 2 years was based on the fact that some of the programs go longer than others, so I think we were just trying to accommodate all individuals who may technically be some kind of senior, but that senior status is really delayed over a period of time. So this 2 years is just to accommodate for those students so that everyone can apply for RVT examination. That's it. So I have a motion to read if someone wants to make a motion.
Actually, can I comment? Since the CVTE is no longer required, should that be stricken from the second to the last line, or is that taken from someplace else in the Practice Act?
So we talked about, I think at the last meeting, whether or not we needed to start striking CVTE from everything. The fact that we're not currently requiring someone to take that exam doesn't necessarily mean that we wouldn't start requiring it at some point in the future if it actually met the requirements under the statute to test healthcare tasks unique to California. So we're just continuing the current use of that exam and all of the other regulations, just to be consistent. So to the extent a CVTE is required for RVT licensure, which it is not today, then it would be part of the requirement for graduates of veterinary colleges to be RVT licensed or registered.
That just made me have a question. So now that we don't have that, are we in section 4841.2, I think it is. If they can't perform them after a certain period of time unless they take the test, would a vet then take the VTNE to then be allowed after that period of time to be a practicing RVT, licensed RVT in California? I guess a graduate.
Right, basically,
Okay.
That's what they'll need to do.
That's what,
Sure.
I make a motion that we approve the regulation and whatever Tara reads.
Motion made, anyone?
Wait, can we have Tara read the motion?
Oh, motion. Tara, read the motion.
The motion is to approve the proposed regulatory changes, direct the executive officer to take all steps necessary to initiate the rulemaking process, authorize the executive officer to make any technical or non-substantive changes to the rulemaking package, notice the proposed text for a 45-day comment period, and if no adverse comments are received during the 45-day comment period and no hearing is requested, adopt the proposed regulatory changes as modified.
Okay, we have a motion. Do we have a second? Kathy seconds. So discussion from the board. I have one quick question and for Tara. So if you read 4808, right, it basically allows exemptions for students that are in veterinary school to let them do surgery under the assistance of, supervision of veterinarian and everything. So, but you have a note down here, authority cited, and then sections 4808. Isn't that the one that, I don't understand what that means when you say the authority cited. It actually is the opposite of what 2027 says.
4808 is the board's authority to make regulation.
Oh, okay. I thought, which one is the one that allows veterinary students to perform surgery and all that other stuff? I thought it was 4808. 4840. Is it 4840? So I guess my question is, why don't we refer, with the exception of 4840, why is there no reference to that, which is in direct, it appears to be directly opposite of what we're saying in the new.
Well, we are referencing 4840 in 2027. We're adding that. And we're not including it in 2027.5 because that's going to be aimed at individuals who have graduated from a DVM program, but who are instead seeking RVT licensure.
Okay, that makes sense. Thank you. Any other questions from the public? Call for the vote.
Ms. Bowler?
Aye.
Dr. Bradbury?
Yes.
Ms. Laredo?
Yes.
Dr. Nunez?
Yes.
Ms. Prado?
Yes.
Dr. Waterhouse?
Yes.
Dr. Noland?
Yes.
Motion carries.
Shall we press on? Amanda has another.
We have agenda item 11C related to telemedicine regulations and comments received.
Okay, first off, I really want to thank Tara and Dr. Sullivan both for helping me with this. We received 2 comments on this, and they both helped review the comments and provide some feedback on it and the appropriate responses, so thank you both for that. They both have a lot of experience and expertise on the subject, so it was very much appreciated, so thank you both. So the regulatory package for telemedicine was noticed by OAL on May 17th. The 45-day comment period concluded on July 1st. As I mentioned, we did receive 2 comments during that time period. I did summarize the comments here and included recommended responses for your consideration and review. What will happen following the meeting, I will include these responses in the final rulemaking file, and then that will be submitted to DCA. And then once it completes the DCA review, it will then go to OAL for their final, hopefully, approval. And with that, I will go through the comment summary and then recommend a response. So the summary of comment 1, so this was a rejection of the telemedicine regulation. And the reason being was because many aggressive pets cannot tolerate a hands-on exam in the veterinary facility, and by requiring a hands-on exam, the veterinary staff could be placed in danger. Additionally, if aggressive pets are brought in for hands-on examination, they often receive a pre-examination IM injection of anesthetic agents, which can increase the risk of anesthetic death in the patient. Further, due to the advancement of technology, a remote video examination allows the veterinarian to provide services in a relaxed home environment and provide the same services of a hands-on exam without the potential of the pet masking symptoms by being stressed in a foreign environment. Telemedicine services will also allow clients in remote areas to visit a veterinarian without having to travel far distances and provide for better service of care. The new remote video exam should be regulated, not prohibited. The board is asked to delay revising the VCPR and veterinary telemedicine regulation pending further discussion of the benefits to the veterinarian, the veterinary profession, the public, and all animals.
So in the interest of time, members, instead of reading the memo verbatim, I'm requesting that, because we did provide this ahead of time and it is up on our website, to provide for board consideration, rather than go over it verbatim. If you have specific comments or concerns or suggestions to add to the comments after consideration of the comments, then a potential motion to move these forward in our final rulemaking package.
My apologies.
Yeah. I just felt that the comments were very well reasoned and well written, and covered. I mean, I can't think of anything else to add.
Any other comments? Comments from the public? Can I entertain a motion to accept these, or do we not need to do that?
We do.
I think we do need a motion.
Okay.
Response.
I second that.
Okay, we have a motion and a second. Any other further comments from the board? Comments from the public? Discussion? Call for the vote.
Ms. Bowler?
Aye.
Dr. Bradbury?
Yes.
Ms. Laredo?
Yes.
Dr. Nunez?
Yes.
Ms. Prado?
Yes.
Dr. Waterhouse?
Yes.
Dr. Noland?
Yes.
Motion carries.
Thank you, Amanda. Well done. I would make the motion that we adjourn and we basically
Are we?
take our comments from Jennifer's, my report and Jennifer's report tomorrow.
Yeah, one potential idea as well to address agenda item 12 related to the Sunset Review Report. As you all know, this is an evolving document, and the template that we are using currently is not even the template from Senate BNP, as we haven't received that yet. A potential idea is to, in the interest of time and not being able to get through this today, this is not something that I think that we should rush the discussion on, but perhaps the board can consider a teleconference just for this agenda item, perhaps in a month. And so we meet before the October meeting to get any feedback. That also provides more time for staff to adjust with formatting and more time for board members to provide comments to us.
I like that idea.
Yeah, I do too. I was going to say the one basic thing is that we have some members that have never been through Sunset Review. Just a general description from you, overview of what it is and what boards are expected to do and what the oversight is, not today but could be. Just if we didn't have to go through the document in detail, just to explain it.
And my plan is to meet with our new board member and to kind of have an onboarding meet and greet with our staff and also an overview of the entire board process, and we can certainly include the Sunset Review overview.
Cheryl?
When do we need a final Sunset Review packet?
So it'll be due to the legislature. It's typically December 2nd, but I believe that falls on the weekend, so it's probably going to be shortly after that.
Okay, so we just got one meeting between now and when it needs to be
Right.
Which is
finalized.
why we're talking about a teleconference in between that only addresses the Sunset Review document, I think.
And would then the goal is in the October meeting, we'd approve the final document, or would it still be kind of in flux then?
It may still be in flux,
That's
which
what I
is why on agenda item 16, we have a proposed teleconference in November for November 21st, if needed. We just wanted to get that on your calendars, because better to have it all saved and not need it than the reverse.
And the actual hearing is going to be in January?
No, the hearings are typically in February or March.
Okay. So my recommendation is no one run for president and let Jamie do it. That's my recommendation to the board members.
I'll take that under advisement and nominate you. So I think, to clarify, we're going to go ahead and set up a teleconference for item number,
Oh, I know.
excuse
So
me.
I have a question.
Oh, never mind, question.
When can we expect the template from the legislature?
So that's a good question. And I know that the intent was to get it to us in July, and we have not received it yet. But what I can tell you is the templates rarely change significantly over years. Most of it, I would say 99% of it is going to be the same.
Yeah.
We think.
We hope.
Yeah.
I do think it's important that tomorrow that we go ahead and go through the rest of the executive management reports, because I think it will help us to deal with the sunset review. And we did not do them last time. So we will turf 12 to a teleconference to be, the date to be set at a later time. And then 13, 14, and 15, we will roll, and 16 into tomorrow morning. I think we'll have time. Okay.
Do we have, the one hearing or whatever is at 1 o'clock tomorrow? Is that the time for it? Is that the only thing that's a set aside time?
Yes.
1 p.m. Got it.
Are you speaking of the closed session?
Yes,
No, we have a petition for termination of probation at 1 o'clock.
Standards.
Oh, I see it. I'm sorry, right above that. And then we go into closed. Okay. So,
Oh, it's over.
motion to adjourn till tomorrow? Do I need that? We don't need that. Okay, we're going to go ahead and adjourn till tomorrow. Thank you very much.
And tomorrow we get to find out about